How hard is it? Well, yeah, but it's a good deal for them. I think that's gonna come. It's. Oh, yeah. I don't know.
Well, all right, let's call the meeting to order for the December 14th. Thank you. The Regional Opioid Abatement Council agenda for Region 2, Laramie County, December 14th. It is 2:01. We do have a quorum. We do have Commissioner Sherrick McNally, one of our voting members, that's got a commitment with budget, but she will be here as soon as she can. So we'll just make a note that at the beginning of the meeting, unfortunately with a conflict, but we have everyone else. We do have a new member though, and I would like to introduce Councilperson Aaron Black. And Aaron, would you like to tell us a little bit about you?
A little bit about me. I've been in Larimer County for almost 30 years and come from the nonprofit world, started the community foundation serving Northern Colorado. That's how I learned about my community when I first moved here from Wisconsin, was working with our nonprofits. I live in Loveland now 14 years. Have never ran for office in my entire life. This is way out of my wheelhouse, and yet behavioral health is my wheelhouse. So I'm very comfortable in this room. I've been following this group since its inception. I've not missed a meeting. I'm so glad they're recorded online. And I'm happy to represent Loveland with this group. And thanks for having me.
And Councilperson Fleck and I did meet a couple days ago and just kind of got oriented. So absolutely, any questions, feel free to jump right in. So
Appreciate it.
thank you. Welcome to be a voting member on Region 2 Rollback.
Sir.
Well, you know, it's been a great year, lots of hard work. I asked Caitlin for the committee and all the technical and subject matter experts, everybody involved, just a small token of thank you. So Caitlin will be doing that. Brian, certainly we want to make sure we get that to you as well. We appreciate you attending. No, you're not here, but you are here virtually, so we'll make sure we get that to you as well. But appreciate everybody's efforts. This, you know, what you're doing is saving lives and improving lives in Laramie County. So we really, really appreciate all the work you're doing. So thank you for that. Was she better?
Yeah.
Wow, her work, well, goodness, yes. Just pass the whole crowd up. I believe, yes.
No, you're right on time. We don't let Chuck.
Well, we'll move to agenda item 2, public comment. Anybody from the public like to make a comment to the council? None, no one online? Okay. We will move on to approval of the meeting minutes from November 15, 2023.
I'll move to approve those minutes. I'll second.
I have a motion and a second. Any further conversation? Seeing, hearing none, take it to vote. All those in favor?
Aye.
Any opposed? And that passes unanimously. We will move to item number 4. And if I do skip like last time, just slap me. We've had this item on the agenda a couple of times and we have not got to it. So we put it right at the top where Caitlin did. Discussion of lived experience stipends. There has been a discussion of those that are serving on this wonderful council that have lived experience to provide stipends. What I was asked to make sure everyone is aware of from Carol is in your packet, you will see the Larimer County Boards, Commission, Councils, Committees, and Task Force policy and procedures. Since the council is not considered a legal entity, and David, you can let me know if I'm wrong, and the county is the fiscal agent, we follow county policy if such is adopted. Correct?
Correct.
Look at me, I'm doing good today. So, to start off, there is a part that's highlighted. Thank you, Caitlin. That is, I guess if I do the Roman numerals, that's 18, right? And yeah, 18, compensation and reimbursement. But it talks about how you can compensate through a stipend for folks like with a lived experience. So we would follow the county policy if the council desires to move forward with stipending those with lived experience. So with that, I open it up. Yeah.
One question about policy here. It says it was a pilot between January 1st and June 30th, 2022. Has action been taken since then to continue this?
I have not seen an updated policy since that point.
And it is, there are lived experience members on other boards and they're continuing to be compensated.
Yes, we have them on the health department, yes. I did not realize that. Thank you for that catch. We don't need to trust that.
Great. And one last thing. So at this past summer at the state opioid abatement conference, there was a lot of showcasing of best practices that utilize this process. And I know that the Northern Colorado Continuum of Care also has a lived experience board who also gets compensated. And so I think it's becoming more and more normal and, accepted. And I know that at least some of our lived experience board members are like, this is not why I'm doing this. And I really respect that. And I'm not trying to overstep on that, but for the sake of others in the future who may want to join this board and just for the, I think just fairness and showing value to your expertise that you bring to this during your personal time. It's not during your work time in your capacity. So I think I just would strongly recommend that we move forward with doing this.
Thank you. Further conversation?
So you don't find any issue since it's not being addressed past the 2022 for us to proceed?
So here's the short version of the conversation. We had this conversation, I think this summer is when this first started to come out. And we went through the IGA and the MOUs, both the state and the local regional one. And there's language in both of those that say members can't use funding, full compensation to any of the members. So the original determination was that we can't use any of the funds to provide this stipend. My understanding, I wish Sarah was here to confirm this, is that she spoke with AG's office and their position was that doesn't apply to stipends such as those with lived experience. Based on their interpretation, since they're the ones that would enforce it against the regional councils, if that was their position, then we went fine. That's okay. That being the case under this, no, I would have to, I didn't print this one out. I'd have to see if that's still the current version of it. But my understanding is they intend to move forward and modify that so that it went past that.
Thank you. I agree with that. It is being more of a norm in the area. It's part of your private time, it's part of your task appointed to you. And I just think it would be a nice gesture to have a say.
Others? Aaron or Brian?
I completely am in favor of that.
Thank you, Aaron. Brian?
Yeah, honestly, as us all kind of being volunteers as far as the opioid council goes, I I don't necessarily agree with a stipend. I think that we all kind of knew when we were coming onto this that this was a volunteer capacity deal, and so I can't say I agree on this one.
Thank you, Brian. Any further conversation? Yes.
I'll chime in. Yes, it's correct. I'm not here for any personal gain. I'm here to be of service to my community. And as you mentioned, to help save lives, quality of life. But I have been convinced about the argument for those that may come after. So my opinion would be that I'm not opposed to it at all, but it's certainly not something I'm looking for. I'm honored to be here. That's why I'm here.
We're honored to have you. Thank you. Appreciate that. Yes, Christina.
I kind of felt the same way, that we were all volunteers, but I had heard, from those of you that went to the annual meeting that some people in other districts or other counties were having stipends. So I just wondered what other people thought, but I certainly didn't expect one.
Thank you. Further conversation, questions? We do have a potential action item there if there was a motion.
I make a motion to move forward with providing lived experience stipends as outlined through the Larimer County policy procedure.
I'll second.
Motion and a second. Any further conversation?
I just want, it to be heard again that I feel that it is in line with the rest of the state. I'm not saying 100%, but clearly I felt it was a majority and that we were in the minority in that as well.
Thank you for sharing that. Any further conversation?
Can I inquire, is there anything that designates how much that stipend is somewhere? Because if you're gonna encumber funds, you should have a specific dollar amount.
Thank you for that, David, because Carol did say, well, let's see, jogging my memory in my notes is there should be a number of meetings that may, and then an amount, a maximum amount. So her opinion was at least 6 meetings up to the maximum, which I believe in here is $500. Because once you go over $500, then there's more reporting requirements, et cetera. So that was her suggestion from the financial. So,
Should we make an adjustment or amendment to that and include the price and the information in that
yes.
motion?
That was kind of why I said in accordance with the Larimer County policies, thinking that that was in there, but so can we amend it to say, are you sure that that's enough?
It was
Up to 6 meetings or up to no more than $500 or whatever is stated in the Larimer County policy. So it has to be changed.
Second that.
that second? Okay, thank you for that. Thank you, David. Any further conversation, questions?
So that would be after their 6th meeting is when that stipend would kick in, up to $500, right? And is that given all at one time, or is that given over a period of time?
That would be up to the council. So, yes, that's good. When I read the policy, there's flexibility there.
Okay. So we can discuss on how that looks. Do we know how many of our lived experience meet that qualification currently?
We've all been 6 meetings, haven't we?
I figured.
Yeah.
I mean, all that I see all the time now,
Yeah.
but I didn't know if that.
Great question, but I'm pretty sure. David, does that work? Yep. Go ahead, Dave. we can determine, or should that be in the motion now?
Repeat that for me, if you would.
I was just wondering, at what point do we start that? It's after 6, but then how does that 500 get distributed? If it's one lump sum, if it's so much over a period of time?
It's a great question because I was actually reading through this policy at the same time to answer a similar question on, is this per year, per term, and what's the trigger for it? And the policy is silent on all of that. So since this is the council that's expending the funds, you should probably, if there's nothing, I don't see anything in this policy that so designates it, you should specify the term that that's for. The term's probably a bad word since you have terms, but the amount of time that has to be covered in order for that to happen. Is it 6 meetings per year and then the stipend's issued per year, or is it 6 meetings per term and you issue it per term?
Thank you. That's good.
Can I ask Jessica how that's done with your experience?
I believe it's $50 per week. $50 per meeting. And is that up to then, that threshold?
Yeah.
Okay. And that's after the probationary time?
No.
But we had said that after the 6 meetings, we have to have 6 meetings to do it. Have we agreed to that? Well, we haven't voted yet. Okay. This is still a discussion. Yeah.
Some advisory, I think it is $40. I've served on that for almost 7 years. And they didn't have a stipend, but they did, and it's 40 and they pay right after the meeting.
I think it was more to the Carol team. 6. I do agree with you that it should be really that year, whatever you define. That could be the mechanism.
Can those details be worked out if we vote on and approve this, that, can I say, depending on the preference of our financial lead, or what's her title? Carol. Advisor. To do it either per meeting or all at once at the end. I would think, all at once at the end of the year, as long as they've been 6 meetings, at the end of the year, they get the stipend each year. It seems to make sense to me, and you're not every time cutting a check.
That's where I think Carol was. We're going to say that over one more time so we have it real clear.
All right,
Thank
so
you.
we'll friendly amendment to the motion to move forward with stipends for lived experience council members, advisory members, per the Laramie County policy, on an annual basis, as long as they've attended at least 6 meetings, to be paid out at the end of the year for that year's worth of meetings. No more than $500.
I second. You can second it, but it sounds good to me.
That's a good motion. I will add one piece of information just so that everybody is aware. The motion is to be in compliance with the Laramie County policy, which does have a requirement that the individuals with lived experience have a financial barrier to participation. And this policy says they have to apply for it. So even if you pass this, it still would require each individual to make an application to ensure that they meet that financial barrier part of it.
Thank you for that clarification.
I think that's okay. That is a paper trail for us to, if we need to submit that for any purposes of, why we paid. I mean, I don't see any problem with them filling out an application.
Since that's the Laramie County policy, I would accept that. I think that if that barrier gets removed at some point, I would like us to move forward to removing that barrier as well. Just an added barrier for people. That's how I see it.
Thank you. Any further conversation on the motion? A second? All right. All those in favor of the motion signal by aye.
Aye.
Any opposed?
No.
So that motion does carry with a 1 no vote. All right, moving on. Item 5, we get a 6-month report from Laramie County Sheriff's Office on the co-responder program that's being funded through the council. So I will turn it over to Sergeant Cook. And welcome your colleagues as well.
Thank you, Mr. Chairman. Yeah, hey everyone. Mr. Chairman, members of the council, and distinguished guests. My name is Robert Cook. I'm a sergeant with the Laramie County Sheriff's Office, and I'm currently assigned to the patrol division, and I supervise our mental health co-responder program and our school resource officer program. And today I want to give you an update on what we've been doing since we were awarded funds from the Regional Opioid Abatement Council, Region 2, last year. So this is kind of our 6-month report. So I want to start with just kind of a basic, actually before I do that, I want to introduce the guests that are here from the Sheriff's Office. We have Captain Ian Stewart, who's our patrol commander. We have Lieutenant Brad Harkin, who oversees the units that I'm involved in. And then we have Deputy Kevin Kingston. And I'll tell you more about Deputy Kingston in a few minutes because he's part of our co-responder team. He's actually one of the deputies that works on it. So thanks for being here, gentlemen. What I want to do is first talk about what co-response is. I think you guys probably have a pretty basic understanding of that, but basically what co-response is, it involves having a crisis trained, specifically selected clinician who is able to respond to calls directly with the law enforcement deputies. The deputies that are selected and part of our unit are also specifically trained on de-escalation crisis intervention team, certified, and have a lot of experience. We really believe that having experienced deputies working in this model is important because they have a pretty good understanding of how to respond and handle handle difficult calls that often involve people in crisis. So what we do is we pair the deputy and the clinician, and then we respond to calls for service. Many of those calls are crisis-related calls, suicide attempts, drug overdoses, community safety issues where people are acting erratic, people are potentially causing threats to the community. And what we try to do is when we arrive on scene, work on trying to de-escalate those people, find out exactly what kind of situation it is, especially when it's involving a mental health crisis or a substance abuse overdose or a crisis that is co-occurring that has kind of both those elements involved. And then we try to triage exactly what we need to do in order to resolve the situation. So our strategy that we use in co-response is basically problem-oriented policing. It's a version of community policing. That concept first kind of came to law enforcement back about 20 years ago. Certainly problem-oriented policing kind of fits the model of policing we do. It's not strictly about enforcement. It's about getting the community involved and realizing that many of the calls that law enforcement officers respond to are not just law enforcement issues, they're community issues. So involving community stakeholders, like our mental health provider for the county, Summit Stone, as well as other resources and other entities in the community, we can all work together to try to resolve those situations and help provide the best outcome. Some of the goals that we have for our co-response program, the first one obviously is to respond to the crisis. We want to intervene, we want to de-escalate, we want to try to help that person get the assistance they need. Sometimes that also means if it's a serious crime that they get arrested. But more often than not, what we try to do is really understand what the situation is, what the problem is. If it's a situation where a minor crime's been committed, what we try to do is understand and use our discretion to figure out if this is a mental health crisis, if it is a substance abuse crisis situation or co-occurring. We try to do is get that person to the necessary resources that can help them deal with that issue. And we utilize our discretion in those cases to make sure that they don't go to jail. One of the most expensive ways to house people, obviously, as many of you know, is our jail. So one of the big primary goals of co-response is to keep people out of jail when it's not necessary. Certainly in serious situations, if it involves a serious first-degree assault or a crime involving a weapon, or it's a serious threat to the community, sometimes even though they do have mental health and or co-occurring addiction or substance abuse issues, they still have to go to jail because we just can't risk the public safety on those situations. But in many, many cases, what we try to do is avoid jail and try to get them the help that they need in order to become stable again, hopefully. And then the last thing we try to do is decrease automatic transports to the hospital emergency departments. This is important because it's so expensive to do that. And it's a drain on the resources that the emergency rooms and their personnel have in order to do their job. We want to keep unnecessary people out of the emergency room and try to get them to the resources that they need that they can actually benefit from and resolve their crisis situations. So again, what we focus on in trying to accomplish those goals is we respond to those crisis situations, those crisis calls involving potential drug overdoses, drug abuse, substance abuse issues, whether it's alcohol or drugs. We also respond to the mental health related calls. Many times they're crisis calls, emergency calls. And then we also respond to calls involving what we call chronic high utilizers. And I think those of you in the mental health world kind of understand the drain on emergency resources that they can sometimes cause. One example real quick is we had a case last year where a woman had called 911 62 times in a 30-day period, had the fire department respond to her house because she thought her kitchen was on fire 18 times, and had deputies respond to her house about 42 times. So that's a huge resource drain, because when you have the fire department come out, or you have a medical situation, you have a bunch of fire personnel with a fire engine or company, and then you have an ambulance, and then you have law enforcement. So that's a huge drain of resources when we can come in and spend the time we need to try to help that person get connected to services and hopefully help them not have to use the drain on resources that sometimes their situation can sometimes cause. So we also spend a great deal of time on follow-up. We try to provide additional follow-up on people that we're working with in the community, especially the high utilizers in the community. When follow-up means like either phone contact or personal contact with these people, a lot of times just to check up on them. When we're not on other assigned calls, we try to respond to those situations where we know we've got high utilizers that are in need of many different resources, and we try to help them get those resources connected. We do just checkups on them, and then we also have a case manager, or a couple case managers from Summit Stone that work with us in order to further work with those people and provide more ongoing follow-up and assistance in trying to get connected. A little bit about our unit. We started in 2018 with one team of a co-responder, clinician, and deputy working together. In 2019, we expanded to 2 teams, so we had big coverage. 2021, we started our youth crisis response team, which is specifically created to be a co-responder unit within the school system in Thompson School District. That has been a very effective and very busy project to work with. So much so that the district is adding a second team to deal with the mental health crisis in the schools. I know for Poudre School District, I know they're also in the process of looking at trying to start a co-responder school-based team as a result of some of the success we've had. 2022, we began our expansion project to add additional teams, just because we've had we started realizing a higher demand for services and for services and calls outside of our 1 shift per day model. So obviously the Regional Opioid Abatement Council is a big part of our ability to expand. And as a result of that, we've been able to add additional teams. And we currently have 4 teams in patrol and then the 1 team in the Thompson School District, as well as a corporal and a clinical supervisor. Thanks. So again, our funding request that we were awarded by the council last year of about $550,000. This has assisted us in adding those additional teams as I just talked about. Next. The interim report, which I filed with the council, I don't know if you guys had a chance to read it yet, but some of our objectives that we had were to add these additional personnel and get them assigned and working on our unit, and that has happened within the appropriate time period as specified in the application. And as a result of that, and using additional funding from outside resources, we've been able to add additional Summit Stone staff. So what we were able to do with the funding that we got from the Regional Opioid Abatement Council was to put that funding towards the cost of 2 deputies and corporal, and then bringing in Laramie County BHS funding to help us staff the co-responder clinician positions, as well as the clinical supervisor through Summit Stone. So one of the things I want to kind of focus on today with this presentation is really focus on the people that we've been able to add to our team. So as I mentioned earlier, Deputy Kevin Kingston is here with us today. He is one of the newer members of the team, and as a result of our funding from the council, he is one of the new positions that was created. He's been with the Sheriff's Office for 24 years. He's got 27 total years of experience in law enforcement. He's a U.S. Air Force veteran, and as you can see, I'm not going to read his whole bio, we'll be here forever, but he has a lot of qualifications and a lot of experience. And again, that kind of goes back to what our desire is, to have experienced and well-trained staff members on our co-responder unit. Other 2 new team members, Corporal Steve Fay, his position was partially funded with funding from the council. He spent 10 years as a firefighter and EMT. He's been with us for about 10 years. He's got also a lot of experience, and he is kind of working with me on our unit as an assistant supervisor. So when I'm not able to go into the field on calls, he's available many times to go with the teams that are deployed to some of those urgent crisis calls that sometimes are a little more hazardous than other calls. So that's part of his responsibilities. Clinician Isabel Torciello is one of our newer clinicians. She works for Summit Stone. She's a licensed clinical social worker. She's got several years experience with Summit Stone. She's only been with us for about a year, but she is a great asset to our team. She's great at communicating with people, especially in crisis. And that's the other thing we always focus on, is when we get therapists that are assigned to our team, we want to make sure that they have crisis intervention experience. Izzy spent a lot of time with mobile crisis response, another one of Summitstone's programs, before she came to us, and she's been doing an excellent job. The last person to the right on the picture there is Deputy Eric Schultz. He's been with us for many, many years. He started as an Explorer cadet. He became a reserve officer, volunteer, and then he's got about 14 years experience with the sheriff's office, and he's one of the newest members that was just recently assigned. So our goal of expanding was really about trying to get more coverage so that when people call and they're reporting a crisis or there's an incident that's potentially a public safety threat, we're able to respond to those to more calls. So as a result of the funding that we received from the council, we've been able to increase our daily hours of coverage from what it started at 8 a.m. to 6 p.m. to now 8 a.m. to midnight every day for our 7 days a week. We've also, through our stats, been able to show that we've increased the number of contacts overall with our unit by adding additional staff to, or by 24%. We'll talk about stats here in just a second. So we have two different reporting systems for our stats. One is comes from our computer-aided dispatch system. And as you can see, this is November 2023 as an example. You can see that the whole patrol division is listed in blue, the co-responder units listed in red, and then the total number of calls. So as they're listed there, mental health calls, 77 total, 62 handled by the co-responder unit, 15 by patrol, and so on, suicide attempts, welfare checks. Part of that stat also includes co-occurring conditions with alcohol and substance use. And as you can see, a total of 194 incidents from November 1st to November 30th. We handled about 62 to 65% of those with our unit alone, which is an increase over what we were able to do prior, when we were really only touching about 36 to 38% of the total number of calls that our agency was receiving. This is our more robust reporting system. It's a Power BI dashboard. And as you can see here, it's kind of hard to see unless I pull it up live, but we have, this is an example of November 1st and November 30th. Total number of contacts were 99 by our unit. The call type is broken down into substance use, evictions, consultations, family problems, delusional behavior, follow-up, suicide threats, and welfare checks. One thing I'll point out is the substance use category was only added in July because we had to make some adjustments to this tool. So it's showing a very small amount of substance use, and the criteria we're using on that is the person has either used substances in the past or they're currently using substances, and that's kind of where that co-occurring condition kind of flows over. We also have it broken down to hold criteria and then disposition. Many of the dispositions are the person is left on scene after they're stabilized with safety plans. So we're really trying to focus on trying to keep people out of the hospital if we can, and also out of jail. Here's another section of our reporting tool. Shows contact types, whether in person or by phone or email. We do get a lot of email requests, which is interesting. Where the location is in Larimer County unincorporated, or Fort Collins, Johnstown, Timoth, Red Feather, Estes Park, other areas. The referral source, where it came from. And then for substance holds, again, that's a newer category we just added, but what we're showing now is an average of about 55% are related to alcohol, 45% to drugs. Next. As I mentioned before, we've increased our ability to contact more people and thereby help more people. whereas before our unit was able to handle about 38% of calls for service. Right now, we're looking at about 60 to 62% of all calls handled by the sheriff's office are handled by the co-responder unit. So what I want to say is that basically stats don't tell the whole story. So I want to give you an opportunity to hear from Deputy Kingston about one of the calls that he went on where he made a significant positive impact on the community and how he was able to discern what the situation was and as a result was able to save a life. So Deputy Kingston, report.
Hello, I'm Kevin. I'm a deputy here at the sheriff's office. So what Sergeant Cook wanted me to bring up, I was on patrol doing my job and I heard a suicide attempt come out, medical call suicide attempt come out. I knew I was fairly close to the location. I responded to that in emergent mode, got there, contacted some family members who were outside screaming that their daughter was in the closet dead. So I made entry into the residence. Upon going into the room, I saw where she was laying down on the floor inside the closet. Started looking at the scene. When I got there, I could see some different types of paraphernalia. The family was telling me that she had actually taken, they thought she took Valium, but from what I was watching and what I could see around there, I could clearly tell it was not a Valium issue. I saw some different styles of paraphernalia that all matched up, either using fentanyl or methamphetamine, more towards the fentanyl side of life. So I immediately pulled her out of the closet. We have been certified and trained at the sheriff's office where we carry Narcan. I carry 2 separate Narcans. I have one on each side of my vest. Realizing that she was more than likely in an overdose situation. She was covered in sweat, water was covered on her hair, everything in that order. She was foaming at the mouth. I had a very, very slight pulse off of her. She wasn't really breathing on her own. So when I pulled her out, grabbed the Narcan, I deployed the Narcan into her the first time, waited a few seconds, did some sternum rubs on her, trying to get her to respond back to me. She still did not respond back to me. At that time, I gave a second dose of Narcan off of what I carry. After giving that second dose, I started getting a cough off of her. She was coughing, and I was starting to get some reaction with the sternum rub, which I knew was a very beneficial thing at that point. And then once that happened, medical was finally able to get into me. From medical, I advised, and they said that they thought they were also told that it was an overdose, not related to fentanyl. I advised them differently from what I was seeing, plus the paraphernalia and everything like that. I advised them differently that I believe it was definitely fentanyl and that I'd already given 2 doses of our Narcan. And they ended up taking her from there. We were able to get her caught up, get her into the ambulance. By the time she was being loaded into the ambulance, she had woken up and began talking to the paramedics. Family members were able to see her, which was the best thing. They actually saw her awake, considering the last time they saw her, they said she was dead. So once the ambulance crew started giving her more care, I believe they gave her 1 more dose of Narcan prior to actually getting her into the bus. She was sitting up at that point. I met at the hospital because I was going to do the mental health hold in regards to the suicide attempt with the overdose. And I had beat the ambulance to the hospital, but when I saw her get brought in, she was fully sitting up, aware, talking to everybody. I was actually pretty upset that we took her away from her high. Still didn't realize, I didn't know for sure if it was a full suicide attempt or if this was a accidental overdose. There's a term that we use back in my days of doing the drug days with my background of, it's called chasing the dragon. So I don't know if she was trying to chase that dragon and she actually tried to catch his tail, what we say, from doing the overdose. So I thought maybe that she was just chasing the dragon and did a little bit too much and almost got caught up by catching that dragon. And the term of catching the dragon is becoming deceased and overdosing and off the death. So don't know if it was a suicide attempt fully or if it was just an accidental overdose or an intentional overdose just to go. because she was having some family issues involving her boyfriend. But that wasn't my deal, so I put her on a mental health hold at that point, and I let the CAC team do the expert work that they do, and the doctors and the therapists there do what they need to do to take care of her. That's real quick and what the story was. But that was basically with the training that we get through the sheriff's office, and each deputy is issued and given Narcan. I carry 2 Narcan on me. I carry another one in my glove box. I carry another 3 in my go bag that I carry on. And my clinician, Isabel, who rides with me half the time, she carries it on her too. So if I need a 3rd dose, I can always grab that from Izzy. She carries 2 on her person too. So
Thanks, Deputy.
that's it. Okay, thank you. I'm going back to work.
Thank you.
Thank you,
Thank you for
guys.
service.
So again, I just wanted to kind of highlight some of the work that he's doing. I think that's not an everyday occurrence, obviously, but that is an example of what we come across. And because Deputy Kingston happened to be in the right place, and he was able to get there before fire and ambulance, I think that's one of the things that does happen quite often for us, even though that we're pretty spread out and we're limited in number. Sometimes we just happen to be at the right place at the right time. So just so you guys know, too, Kevin knows this now too, but he's going to be honored with a life-saving award as a result of that incident at our awards ceremony coming up in January. I want to touch a little bit on harm reduction that we're doing with school districts. Thanks to Commissioner Shattuck McNally, I was able to find out more about the State Attorney General's program about pill abuse and fentanyl abuse within the schools, and kind of this program that was created by the Attorney General's office, initiative called Colorado Connect Effect. This is a great program that's been set up. I don't know, I know that Commissioner Shattuck McDonald has presented on this before to the council, but going onto the websites and actually looking at some of the material that is there, I think it's very much geared towards kids. And as a result of our association with the Regional Opioid Abatement Council, we were able to get these posters put up in every secondary school in Poudre School District and in Thompson School District. So we are working on that as well with our school resource officers. So in conclusion, I just want to say we have met the objectives that we listed for our grant from the Regional Opioid Abatement Council. That's a typo there. That should say 12 a.m. Teams have been, or the coverage is 8 a.m. in the morning till midnight every day. We've increased contacts by about 24%. And we're also very active with the Longview Acute Treatment Center. We've been able to, we actually brought the first patient there when they opened. And we've been working with them in a collaborative effort to try to provide guidance and design on workflow ever since it was first thought about, and ever since now that it's been and open. We've also, as a result, I think, been able to become really recognized as a leader in co-response across the state and even across the country. We've presented at several different conferences and seminars. And I think that just goes to the quality of personnel we have and the type of unit we have, and the way that we've been able to expand our unit to meet that public demand. Next. So in summary, I just want to say thank you on behalf of the entire Sheriff's Office, our co-responder unit, for your support in helping us to accomplish our objectives, and look forward to continuing to working with you guys. Any questions that we can answer?
Any questions?
Yes, sir.
The graphic was, of course, hard to see on the pie chart. I know the percentage was small. Do you have the actual percentage number of substance use related calls?
So what it's showing right now, because it's a cumulative report that goes back to 2018.
Okay.
It's only showing like 2% of all those.
From July of this year forward was all that was shown on that chart. Is that right?
I believe so, yeah. So, and I can get you guys a copy of the PowerPoint, and we can spend some more time whenever there's specific questions about that. I can kind of demonstrate the reporting tool as well.
Yeah, it would be really great to understand that percentage more in real time.
Sure.
If
Yeah,
possible.
because it is something that we just added to that reporting tool. And that reporting tool is kind of created by one of our deputies who's pretty good computer whiz. And we actually got a lot of assistance from City of Fort Collins, Mr. Willard, I believe. Is it Willard in IT? I'm not sure if you know him or not.
Kevin Wilkins.
Okay, yeah, I think so. He's been able to share a lot of information that helped us build our platform. So even outside of the sheriff's office, we're kind of working with other teams, other co-responder teams to try to build that system. But we just recently, like I said, in July, added that additional reporting tool about substance use in order to try to track some of that. But right now it's not, so it's kind of blended in with the other numbers too. So be glad to talk with you more or share that data with you guys.
Awesome. Thank you.
You're welcome.
Sergeant Cook, thank you so much. And I know you and your team have been presenting a lot, and I think of the Colorado Association of School Boards, I believe the school-based one presented and was well received, and getting a lot of calls on that. Thank you to your leadership that is supporting you. I know you've talked about this, but I learn a little bit more about this all the time. I've been fortunate to see this in action, right along, and actually had this happen at one of my community conversations where we had to have a co-responder. Thank goodness you guys were all there. Can you go a little more into, to share a little bit more about the follow-up? Because sometimes I've seen where they're calling to the home like a day or two later. You guys actually, like, you don't just, it's not like they want to do. You're following these people, following with emails or phone calls, or the clinicians are making sure they're following their plan or getting into other resources. Is that correct?
That is correct. And I can give you a good example of a person that we're working really closely with that lives in unincorporated Larimer County at one of the trailer parks. She is a victim of human trafficking. She's she's a recovering drug addict, and she's also became a pretty high utilizer with our team. And she would call to report things that weren't there, things that weren't happening. So what we do in situations like that, and this is just an example of one case, but what we try to do is get in touch with that person, create a rapport and relationship, and then continually check on that person. So for a while, like Deputy Kingston was involved in doing like weekly checks on her when he was working. And we built that trust and relationship to the point where she was able to actually reach out to us and say, I really need help. I'm not eating. I feel like my anxiety is off the charts. And additional to that, we were able to get a case manager from Summit Stone to work specifically with her when we weren't able to stop and check on her. So we basically were able to get her to the point where she was able to finally trust us enough to go with us voluntarily to the hospital and get mental health treatment. And now she's been taking her medications. We still check on her to make sure that she's still doing well, but I think that's an example of when we identify a person like that who is in need of a lot of resources, a lot of services, we're able to take the time that we need in most cases to spend that amount of time in order to really solve that problem and help that person resolve their issues. But just in general, the calls that we go to, we are a crisis intervention. And sometimes we can't spend as much time as we'd like to, but we do conduct follow-up either by phone or in person on most cases. As long as HIPAA, can comply with HIPAA and not violate that, because sometimes we do run into roadblocks with like treatment centers not being able to tell us when they're going to be released. But after somebody is on a mental health hold and they're released, we try, and then we find out that they have been released, or we see them again, we're able to check on them and make sure that encourage them to keep following the path they're on. Or in some cases, we have to be in order to try to reconnect in the services. Because one thing that happens quite often is people will start taking medications and then they believe they're feeling better. So then they stop taking them and then start having issues again. But follow-up is a big part of what we do on a daily basis with all the people we contact.
Thank you. And so my last question, unless someone else had a question. So I know a lot of times mental health and substance abuse or substance abuse disorder is kind of co-occurring issues. But I know since you were the first entity to treat the first patient to Longview Acute Care Center, you guys are also not only mental health, but you're maybe are you transporting folks for medically assisted treatment at that center or hospital? So you're doing that quite a bit as well.
That's true. That was in the slideshow. I think I was trying to go through it as quick as I could, so I might have missed that part. But that's one of the things that we're able to do too, is offer people who are intoxicated rapid access to MAT services, so that whether it's at Summit Stone or through one of the hospitals or other entities that provide it, but a lot of times we'll ask people straight up, if you want help and you're struggling, we can get you that help right now and you can start today. So we not always get full cooperation with that. Sometimes people are pretty reluctant, but we do really focus on trying to get them in the mindset where they can help themselves and we can help them help themselves by getting them to rapid access treatment.
Appreciate you answering my questions, and I really appreciate you guys expanding and trying to capture some more of this data and do more tracking. So thank you. Appreciate it. Great presentation.
Thank you, Commissioner.
I just had a quick question. You had mentioned those posters were of the Colorado Connect effects being distributed. Are they up in Estes Park, do you know?
They are not up in Estes Park yet. That's on my list to get them up there.
Okay.
I'm connected as the school resource officer with both Thompson and Poudre School District. That's kind of the area of responsibility I have. But I know I've had several conversations with teachers at Estes Park, and I believe I forget the name of the school district. Is it in Estes Park, the school district there?
Yeah.
Yeah, the Estes School District. But basically, they've given us a lot of ideas, so we've collaborated with them about co-responder or coffee with co-responder programs, where I know Estes High School is really innovative and doing peer support with their kids that are struggling, and then having co-response and law enforcement kind of help sponsor that. So we've kind of taken that idea from them, and we've had some good success over the last summer in actually doing some of those with our kids at the high school. But I have not had contact with Estes yet, but that's on the plan. And I know Commissioner Shattuck McNally has more posters that I can take up there. So
If you need help with
Okay.
facilitating that, I'd be happy to do so.
that'd be great. Okay, thank you, ma'am.
Thank you. I have a question.
Yes, ma'am.
So does the LCSO back up, say Loveland PD, if they don't have enough co-responders and there's a call out? Do you guys partner with each other?
We do work pretty closely together. There's a little bit difference between Loveland co-responder program and our co-responder program in that, as you probably know, having a background in behavioral health, Loveland uses a secondary response model. We use a primary response model, but that doesn't stop us from working together on cases or people that are in need of desperate help. Just a couple months ago, we dealt with a gentleman who the Loveland co-responder team was really struggling to try to get assistance. And I was able to work with Lieutenant Murphy from Loveland Police Department to get a court order mental health evaluation completed. And then Loveland Police Department and our deputies worked together to try to get that person in protective custody and take them to the hospital MCR. And I think that person has done really well since they've been stabilized and they're on medications. So we do our best to help other agencies anytime. I'm also working on kind of an MOU. It's kind of just in the idea stage right now, where if Fort Collins has a big incident, their unit's tied up, and we have a big incident, our unit's tied up, that we can maybe trade resources and help each other out. Because we do that in a very small scale now, but just to make that more regular when it needs to happen. But we do have regular meetings, monthly meetings, where every co-responder unit in the county has a meeting where we talk about how we can work together, and a lot of times how people will move from one jurisdiction to another. I mean, they're not tied by boundaries, right? They're going to go where they decide to go. So I think just sharing that information, making sure that everybody's aware of the same people that we're working on and kind of what we're doing to try to help them, I think makes a big difference. Absolutely.
Yes, another question.
Sure.
Quick.
Sure.
So this program goes to 2 a.m., correct? So we're still.
I'm sorry, that was a typo. So
Typo.
we have coverage from 8 in the morning until midnight.
So we're still not 24/7.
Right.
Would you like to expand it to
Yes.
24/7?
Yes, I would. I can tell you that we look at the times that calls come in, and a majority of the calls come in between the hours that we have coverage now. But there are still some serious calls that come in after midnight, and our night shift deputies have to kind of deal with those as they would normally have. But I think our deputies, if you asked any one of them, they would tell you they really appreciate when a coverage responders on. Because that gets them back in service and it gets the person that is in need, someone who's a little more qualified to try to help them.
Thank you so much.
You're welcome.
Can I tag one? So is it an issue with not having the clinicians available during that time period or the co-responder trained deputies or both?
So the unit that we have 5 teams now. We have a day shift and a swing shift that goes till midnight, 7 days a week. And then we have the youth crisis response team in Thompson School District. So it's just a matter of we haven't staffed additional clinicians or deputies to cover that gap in time. And that's a goal, but that's more like, in my mind, more of like a 3-year goal. In the next 3 years, we'd like to expand to make sure we do have 24-hour day coverage.
Thank you.
You're welcome.
I apologize. I did let the chair know I have a partial conflict, so I have to run over to court now. But I also wanted to let the council know, based on the questions about the stipend policy, contacted the Larimer County Director of Human Resources, got confirmation that while 100.1J has that time period in 2022, program's being readopted in a separate policy, so it's covered under identical terms.
Thank you for checking.
Okay, thank you. By the way, I would have voted yes. So, okay, so I think that was a great report. Mr. Chair, I'd like to make the motion to approve the 6-month report and disbursement of the second payment of grant funds.
We have a motion and a second. Any further conversation? All right, all those in favor of the motion?
Aye.
Aye.
Any opposed? That passes unanimously. Doing a little time check, we've got just under 30 minutes. We've got a couple more agenda items. We do want to hear from NCH and CHN briefly on their proposals for 2024, and then we want to get into our housing priority project. So we can really try to, as quick as we can, once we get to 3:30, we will then have to move things to the January meeting. That's just how it works. So we'll go real quick with NCHA.
Yes, you want me to talk, Tom?
Yeah, that's what I mean.
My laptop decided to restart on me, so I have no way to, I can't explain.
Yeah, don't worry.
Okay.
All right.
I'm sorry.
It's live.
I'm MJ Jorgensen. I'm the Director of Addiction Response with the North Colorado Health Alliance. We were very fortunate to be funded by this council for 2023. Are hoping to pursue funds for 2024. Really, the funding structure and proposed activities from 23, we're just looking to do again in 24. We saw a lot of great success throughout those 4 priority areas. Reminder for the council, those were community education, stigma reduction, provider education, care coordination, and improved treatment access, and then evaluation. The only part that is changing really in scope is the evaluation structure. We did a landscape analysis, and that report will be available for the council come February, and when we close out 23's grants. And now we're on to next steps. We're on to new horizons. What do we do with that landscape analysis and the evaluation that took place? Well, let's provoke additional community engagement around it, create a sounding board structure so that we can differently collect substance use data, Cook's issue is not unique. And we found that in our landscape analysis that there isn't really great data that is universal across substance use. And so that is one of the things that came out of that assessment is, holy cow, we got work to do. And so really we have to build that infrastructure. And so Butler is our partnering institute who is supporting that research. They proposed building a regional infrastructure to support different data gathering analysis quantitatively and both qualitatively as well. And so that is part of that shift. You'll see that in your packet. But to kind of bring folks up to speed on those additional areas, our team operates an incredible program that has been longstanding in our region called the Colorado Opioid Synergy of Larimer and Weld. That sits under the umbrella of our addiction response team. And there, our team's goal is really to just connect people to the care that they're looking for, regardless of their payer source, but we do not build any structure to support folks. And so we try to make sure that our staff are exactly where people are. That is the goal. And so have been able to engage folks in our community-based organizations, in our hospital systems, emergency departments, criminal justice systems like our jails and probation and alternative sentencing spaces, and also support with rapid access to MAT services. So we have a 24/7 call line for folks to reach out and get support when they need it, when they want it, because we know that timing is so critical in this work. And so that is part of what these funds go towards, and a big chunk of the request that you see before you. Evaluation is that second largest sum. And then community education, that has looked like overdose education, substance use education, harm reduction education as a whole, ensuring folks know what is available for them and how to access those resources across the county. In addition to overdose awareness day events that we were able to host in 3 communities in Larimer County last year, and hope to do so again. In the provider education space, we built out two different structures, one of which to support development of the peer recovery workforce, which we have a robust peer recovery workforce. I'm very proud of them. They do incredible work. They are the secret sauce, I would argue, to being successful in substance use work. So that infrastructure to allow for free access to that first 48 hours of learning has been very exciting for the community, and slots are full. So that is again in the request, and then the Rethinking Addiction and Recovery event also is making another appearance in your budget. That is a cross-sector offering to bring our workforce up to speed on existing practices in our region, but also statewide and national best practices surrounding substance use and recovery. That's my quickest version. That's all I got for you, Tom.
The next door people loved it.
I do have a voice that carries, so that's not surprising.
Just a quick comment, just to let you know, we are first meeting for our data subcommittee for the ROAC. We've had some great discussions, and it looks like we might be able to bring some recommendations to the council pretty soon, about maybe 2 positions, and one of them would be data analysis, bring all the data together, especially from this council. And we have some great technical people here at the county so we're working on that as well. So just so we're not really working in silos, just wanted to kind of bring that to your attention. So
yeah, and Butler's desire is to be part of that convening structure for us. So then we have somebody who's outside of the community who can really look at this with an agnostic lens. I'm also on that statewide data council.
Oh, cool.
The bottom line, the total request is the same, $650,000.
It is $312 more. I know.
Inflation, it's got us.
Yeah, everybody's,
Yeah.
we gotta write checks, we gotta pay people's salaries, that kind of a thing, that cost of living increase.
Any further questions?
I know, very specific.
You said 300 and what, 300?
$12, yeah.
$12. Okay.
So the total request, to be clear, across those 4 approved purposes is $650,312.
There a motion to approve?
I'll make that motion.
We have a motion,
Second.
a second conversation. I will disclose as I did last time. I serve now on the Northern Colorado Health Network Board of Directors, so I will abstain for purposes of just making sure, disclosing this. So, any further conversation? All right, all those in favor, signify aye.
Aye.
Any opposed? And I will abstain. So that motion carries 5-0.
Appreciate that. Thank you.
Thank you.
Thank you.
Okay, Northern Colorado Health Alliance. Alliance Network.
It's okay, the Murphy Center got mixed up.
No, I know better than you guys.
Somebody's gotta rebrand.
Well,
Health department, health district, health network, health alliance. Let's all fight for it if you can.
I'll just say public.
Hi, everyone. My name is Arlo. I'm the manager here at Northern Colorado Health Network. So we. Okay, no worries. So I just want to kind of go over what we touched on our 6-month mark here, which was kind of how many participants we worked with during, with the money from this grant during this time period. Basically, moving forward, the next one, please. We kind of outlined our 3 goals that we're wanting to bring forth for the 2024 year. Biggest one that we've talked about is wanting to obtain an outfit, a van to expand our outreach services. We wanted to expand our hours and locations to provide more access to testing for HIV, Hep C, and STI testing with the linkage to care. And then increase or sustain our funds to continue with the quality of supplies we've been providing to our participants. I've been going through the budget. I've been working with wholesalers and different kind of retailers to get supplies at a better cost to be able to provide higher quality and more supplies to our participants. So a lot of research and stuff has gone into that. So talking about the van itself, we are requesting to have our current 250 continue, which was helping with supplies, employment, travel for our staff. But we're also wanting to expand our budget to include outfitting a vehicle and maintaining, gas repairs, the renovation for that going forward. A little history about the use of mobile programs within harm reduction organizations. It actually dates back to the 80s. There was a harm reduction organization called the AIDS Brigade in Connecticut, who in 1980 actually started handing out sterile supplies in a van. And so it's something that's kind of been, brought forth throughout the whole history of harm reduction, because there's a lot of benefits to it that include, things like staff not having to use their own vehicles. We started doing mobile outreach with staff vehicles in July in Loveland, and we've seen over 100 participants in that time, just with our own vehicles 1 day a week for 2.5 hours. It gives folks more privacy, so we're not out in the open, exchanging supplies. It helps if we're going to actually meet people where they're at, which is a huge principle of harm reduction. And it helps with people not having to transport paraphernalia, so it's safer for the community, it's safer for participants, for us to be able to go to them and dispose of any, supplies and things like that that they may be wanting to get rid of. Yeah, so just that kind of added layer. And with the van, we are wanting to, outfit that with shelving. We want to have seating for staff, driving and transporting, but also seating for us to do STI testing, Hep C, and then, HIV testing along with like linkage of care, resource navigation. We kind of want to make it an all-in-one stop. We actually have 3 other locations throughout the state who have vans to do mobile outreach. We're kind of secluded to a very nice neighborhood in Fort Collins, next to Old Town, which isn't always the best place for people to go get supplies. So if we're able to go to them, whether we're, partnering with other service providers and providing supplies and services at those locations, or going into camps, we've done a lot of boots on the ground, like walking and finding people and telling people about our services. A lot of folks already know who we are, and then they're very excited to see that we're in Loveland, able to supply Narcan test strips and other supplies. So that's kind of the main ask with a budget increase for the van itself. If you go to the next slide, we've already exceeded a lot of our metrics for this, so we're wanting to increase quite a bit, which we feel we would add some metrics with the van, including like outreach visits per year. But also we've increased, we want to increase our unique participants by like 300%. So we blew this out of the water just within the first month of having this. So we are wanting to kind of increase, and if we are able to go to these other locations and meet people where they're at, we're going to be able to, really access communities, more rural communities that we haven't been able to, access before. And people are asking for it. People are asking, when can we come to Loveland more? Can we get to Estes Park? We have people who drive from like far out. Like we have people who drive like from Wyoming even to come get supplies from us. So being able to be mobile, to get to more locations, brings traffic kind of out of the neighborhood that we're in currently, and helps people not have to travel as far, have to carry paraphernalia, these other like kind of risks to their safety and to community safety as well, to dispose of those supplies. There's kind of a second part to that too that was asked very last minute, about counseling. Our other locations with the opioid abatement money has started spearheading kind of a mobile SAP or syringe access, exclusive counseling programs. At the harm reduction conference about 1.5 years ago, I had a great pleasure of meeting this therapist. His name's Maurice Bird, and he works at the Harm Reduction Therapy Center in San Francisco. And he kind of piloted this meet people where they're at anonymous counseling program. So, I went back to our director and we talked about it a lot, and she started implementing it in other locations throughout Colorado Health Network. So in Pueblo and Denver, we have a walk-in counseling. People can stay anonymous. They can come and talk and get that initial entrance into care and treatment. And so I was asked to propose a budget as well, which is included in your guys' packets here to fund that, as well as an extension of our mobile services and then treatment as well. With that program, the pros of that are people aren't having to wait on wait lists. A lot of times our folks have a hard time getting into care and maintaining counseling. They've seen a lot of improvement with folks being able to come in for drop-in counseling and to speak with people, kind of one-on-one, and then continue their care from there. So being in that comfortable environment, having that flexible schedule has helped increase people's adherence to these counseling sessions as well. And it's truly client-centered, meeting people, where they're at as they're ready, and letting them choose how their care kind of looks like. So that's been going on in our Denver office for about 6 months, and our Pueblo office for about 5 to 6 months as well. And they're pairing that kind of with the mobile teams, and the counselors are going with folks, to be able to provide that, just kind of next level of care that some of our coordinators aren't able to do because they're, clinicians as well. That was kind of a lot. A lot of it was just kind of put forth to me yesterday. So yeah, that's basically kind of all we have. Sorry, I didn't have slides for that last part.
So, Arlo, real quick, making sure I understand. 250,000 last year. You're asking for 402,561.
For the, yes, for two. Yes, for year two as an extension of the prevention specific. And then I was asked by Danny Willis to present for treatment a separate proposal that she got approval for, to submit that proposal. So it should be in the packets as well.
Okay. Just a reminder to council, you'll see in the packet, we've earmarked 250,000 to match for year two. So that would be an increase of $150,000. We'd have to go back. And we don't Carol here, so.
Yeah, and I don't know, that's a very large increase. I think we have to think about the bucket.
No, absolutely. So that's kind of what.
And then, who asked you to submit another budget?
So it's for our treatment, our behavioral health department, which is kind of separate from prevention. We asked, I think, we talked to Caitlin, and who was the other person?
So they sent me the request initially saying, can we add this proposal? Checked in with you, Tom, who said I'm fine with it. I said, I'm
sorry. I didn't see it was an increase of 152,000. Yeah, so no. Yeah, because that's not what we council.
So just to be clear, the two additional things is the van and staff for the van.
Yeah, so our staff that we already have would be running the van. So it's additional is the van itself, and then the counseling, which is its own separate proposal.
And that looks like it'd be bilingual, bicultural clinician.
Yeah, so we have an intern who is bilingual, bicultural. They want to hire on another clinician, and then also pay a BSW undergrad intern to do the care coordination for stipends for the MSW and BSW interns.
So maybe we should consider potentially the current, and then talk about a process for that those increased items maybe or next month.
We have the other ones that we have in the bucket, and that would take away from them, and we're gonna have to weigh out the budgets, and that takes away from our housing, things that we might want to do, or that other one I brought up about the students, that are, substitution involved in support, so just. So I just, I'm not feeling comfortable with that line, so I agree.
Others, Brian, I can't see if your hand is up, making sure you're included here.
Nope, all good here.
This is for us to be able to reach Estes Park, reach Loveland, so it's not as much of a strain on our staff taking their personal vehicles.
I think it's just a matter of funding. Yeah, we'd love to fund everything, but yes.
So as everyone's thinking about this before the January meeting, and in considering what an aggressive increase in funding might look like and if it's possible, it is aggressive, but I think you guys showed through the beginning of the grant period, really blowing away your metrics, and I appreciate that. Harm reduction services and counseling combined with increased accessibility to the scope that they're looking to do it, there is no more powerful tool out there to meet people in the throes of active addiction, where they're at, build trust, and provide a pathway into treatment, recovery, and to save lives. I don't think there's a more powerful way to do it. So that's my opinion.
Well, I appreciate you sharing. Might I pose the question to my manager? Would you also like to speak to, you kind of touched on this, but I think something that's really important to the community and to the council, and part of what we do is clean up within the community, that van would increase our capacity and ability to serve the community in that way exponentially.
Yeah, appreciate that. It's just about funding. So there's a process. We have allocated 250. we would need to come back, look at the other requests that are on the table. We do have two more to look at that if we have that funding. So is there a motion? I think you were kind of laying one out.
250. Yeah, I'll make a motion to continue the 250 for now into 2024, and then to revisit the other two once we have a chance to look at all the other requests so that we can weigh them all and make sure we're looking carefully at what's added. And I see you're emotional, and so I want to apologize if this is causing any emotion for you. You guys do amazing work. You do amazing work. Oh, yeah. Oh, absolutely. And you do amazing work. And we know that outreach is super important. We see that with Outreach Fort Collins, and there's in just certain areas. So it doesn't say that this is not important, but so that we can weigh it alongside the others too. Thank you so much.
Thank you.
Motion, yes.
Second, any further conversation? I would like to add to that, great work by the, the group, and we want to make sure that we're funding all the other aspects that were discussed by the council. So appreciate your feedback on that as well. Any other conversation? Seeing none, all those in favor? Aye. Any opposed? Hearing none, that passes unanimous. Okay, thank you for that. Discussion items, we've got a few minutes here, so we're going to probably unfortunately moving this to January. Discussion of proposed housing priority projects that have been discussed at our previous meeting. We do have the Abundance Foundation Housing Project, my understanding, and they did present, if you recall, one of our previous meetings. So, Brian, please.
Yes. Yeah,
ahead,
so we have, I'm the founder and executive director of the Abundance Foundation. We have 2 sober living houses in the area. We have a men's and women's right now, and we're looking to expand that this next year to another men's and women's house based on the demand that we have right now. We are, as of right now, we're fully self-sufficient through Medicaid billing for our peer services. So our staff cost and administrative cost is already covered. We're looking to expand the program wise with the house and provide additional scholarship funding to help get people into sober living houses. So we do it on on a sliding scale basis. So we cover 50% of their rent the first month, 25% the second, and 25% the third, if they're meeting all the obligations of our programming and the requirements of being in a house.
What would be the ask again, Brian, that you would need?
I don't have the exact number that we would be asking for. We're just doing the interest for it right now.
Was it the 300,000?
That was, yeah. So it was about the 300,000, yes.
And that would serve how many people?
We were able to serve 114 in the program overall last year, and we've had 17 come through our houses this year. We opened the women's house in December of 2022 and the men's house this last August.
Any questions for Brian? Further?
Wondering if you could come back, and I feel like we're rushing this.
Yeah,
And housing is a super important aspect of what we wanted to do, and I'm sorry to the folks from Rescue Mission who are at Harvest Farm who are here and Abundance. I just feel uncomfortable trying to rush this through.
And we don't need to vote. We're just getting to get the information, and then definitely we'll take it to January. But yes, I appreciate you on that because we are rushing.
And also, we were hoping to have Marshall, but we didn't get him on the agenda for this day because we have these other reports that we need to get done. And Marshall has a wonderful presentation about some ideas he has about housing. And remember, we had asked him, but we ran out of time last time. So I'd like to make sure he has, I think he said he needs 15 minutes to present at the next meeting. And, I just want to make sure we kind of value his input and make sure we get a good solid 15 minutes.
Absolutely.
If I might, Mr. Chairman, that request.
Yeah, absolutely. Okay. This is information gathering, so no votes needed here, no action on it. Thank you. Brian, appreciate that information. Harvest Farm?
if I could, I want to just touch on one aspect of our ask because it's somewhat unique. I think you have it in your packet, but we have two proposals, and I want to explain just a quick reasoning why we have two proposals. So first, my name is Seth Forwood. I'm the Senior Director of Northern Colorado, so I oversee Kyle at Harvest Farm and also Fort Collins Rescue Mission. I really do just want to take 2 minutes to say that we wanted to present two proposals to you. The first one is regarding Fort Collins Rescue Mission, and I would feel remiss to not at least inform you of what we have going on the other side of our operations that is connected intimately with Harvest Farm, but is not located at Harvest Farm. So we're right in the middle of building a new shelter on North College. We're in the middle of our development process with the city, and so and fundraising, and we have lots of effort and money dedicated to this, but we still need to raise 7 out of the 27 million to provide 250 beds of shelter that is will displace our 89 beds of shelter. And so I feel like you can't talk about addiction without talking about homelessness. And you can't talk about homelessness without talking about addiction. And so I just wanted to introduce that aspect of the first proposal that we have for you because it's the shortest one. And I want to kind of recognize that it's a little off center of what was proposed or discussed last meeting. Kyle did a great job with that. And I hope we can go into much more detail at the next meeting with the Harvest Farm proposal because we're really excited about being able to do what we do and have been doing for decades, just on a larger scale with greater impact. So that's where I'll leave it for now.
Appreciate it. Just so as we're getting information.
Yeah.
What was your Harvest Farm proposal one?
Yes.
Okay.
In fact, both of them are, and they're split up. We also split them up into different line items so that also you have complete discretion to say, well, we would like to fund this line item and these other line items are secondary to the council.
Just to clarify, I think the total is the 1.2.
Correct.
Yeah, so it's a little over 1 million for the Harvest Farm capital project, and then program like for sheltering is 200,000. Is that correct?
In one of the proposals.
Oh.
Sorry, that's confusing.
Okay.
Two
Oh.
proposals, 100.2 each.
Yes,
Correct?
1.2 each. Yes.
I was gonna make a suggestion.
Please do.
No, when you're, well, we obviously have some things to think about, and obviously we run out of time, and I would like to request our January meeting, since we also still have to vote on these things, and Marshall, you got a presentation, but I'd like to suggest our next meeting be moved to 2 hours if possible, give everybody enough notice, because I think we're needing more time to have this discussion. And also, we met as a subcommittee yesterday for the data subcommittee. I know Beth couldn't come, but we had a really productive conversation. And there's a proposal for maybe an administrative, all those things, opiate person. And I wanted to present that so you can think about that, because that's something that the drug task force is looking to maybe partner, maybe a regional person. I want to make sure we talk about that a little bit, along with the administrative costs, and I was hoping Laura could represent on that. But Dr. Jared Olson also brought up, there is a disproportionate number of folks who are dealing with addiction or having opioid deaths in our Latinx communities, and I feel like maybe we need to take a pause for there, and maybe we need to think about a targeted response or outreach to that, and maybe we need to think about that, because really right now, as I look around the room, I just want to kind of bring that up, and I think we should have that conversation. So before we start throwing away, not throwing away, but start committing these dollars, I also think we need to kind of look at that number and just kind of think about that and be thoughtful. So just so I didn't know if the council members would be open to extending another half hour. I know all of our time is really valuable, but I feel like I agree with you, Beth. I feel too rushed to really make these decisions today. And so
you're proposing the Thursday 25th, going 2 to 4?
Yes. I think, you know, at the 25th, and I know I have something at 5, so I'd have to definitely get up, but yeah, I'd like to increase that because I think that's really.
Agree? Or
So it would go till 4.
Go till
We
4.
would come earlier.
that work, Aaron?
Yes, sir.
Ryan?
That's fine for me.
Wonderful. We've gotten some information on housing, so we've got some of that to start chewing on. We were planning on bringing on the social connections and reducing loneliness. That was the other piece as well. We may hold out for that in February because it sounds like we'll have quite a bit, but we can certainly bring all the discussion items to the January meeting and we'll have 2 hours. All right. Yes, sir.
Perhaps we can open with the presentation since we've
Yes,
had to skip over it twice, make sure we get time.
that's a great idea. We'll do that.
Thank you for your patience, Bruce.
Any further comments or questions? I entertain a motion to adjourn.
I'll make that motion.
All right. All in favor of adjourn?
Aye.
Thank you.
Thank you for
Great meeting, everybody.
Thank you.